good evening, and welcome to our special live stream broadcast, all presented by the University of Maryland Medical System. Whether you are watching on our Facebook, on our Radio 1 Baltimore YouTube channels, or at magicbaltimore.com, we want to thank you for joining us this evening. I'm your host, Ryan the Lion. You can hang out with me inside the Lions Den weekdays, Monday through Friday, 10 a.m. to 3 p.m., of course, on Magic 95.9. And tonight, I'm glad to be your host. It's all about building up the health of the community, and tonight is about heart health and hypertension. And of course, we know February was American Heart Month, so we want to make sure that we keep the conversation going this month. And to kind of help me make sense of all of this and help raise the awareness of hypertension and high blood pressure, our special guest and featured expert, he is also an internal medicine and hypertension specialist at the University of Maryland Medical Center, right down there at the Midtown campus, West Baltimore. That's what's up. He's also an assistant professor of medicine at the University of Maryland School of Medicine. I'd like to welcome our esteemed guest tonight, Dr. Wallace Johnson. How are you, Doc?
I'm fantastic.
Yeah, glad to have you here.
So thank you so much for having me on.
Yes. I'm glad we got through all the technical stuff, and we're here to make this happen because a lot of information needs to be given out to our community, especially on this topic about hypertension and high blood pressure, right?
Sure.
So before we get into all of that, let's just get a little bit background about you, your history and your specialties.
Oh, sure. Yeah. Well, first of all, let me say to all the native Baltimoreans out there who might be listening, I'm a Baltimore native, grew up in Northwest Baltimore. And the other thing I want to say that more importantly, moving forward is that I've really been devoted to and thinking about how we can get rid of health disparities. And of course, right after everybody knows what happened in January, we had a change in administration. If you didn't know about health disparities before, guess what? You're going to know about them now. And unfortunately, health disparities might come knocking at your door, and even if you don't answer. So the bottom line is that what I want to say is my devotion and what I've done, and we've been very happy to do here at the University of Maryland, is we've been able to do things to help with health disparities, realizing that, where you eat, where you sleep, and where you practice, of course, is where you're going to see the disparities and where you can do the most good. But you've got to get out there. When we say to everybody who's out there listening, everybody out there, if you see something, do something, like they say at the airport.
That's right. Big facts for real. Now, we're talking about hypertension tonight. And Doc, I'm glad we have you as an expert tonight because this is so important for our community. I got a stat that it says in 2025, it's estimated that 1.56 billion adults worldwide will have hypertension.
Yes. Yes.
That sounds unreal.
Yeah, well, I can tell you another thing, too. Here's interesting. Here's what I like to point out very quickly. Is that when I was watching the History Channel once, now it's the History Channel. This is not sponsored by any university or pharmaceutical company or anything. They said the number one reason why more people don't live to be 100 is hypertension. Just the History Channel, man. Nothing to do with any medical thing. They were just talking about aging up to the age of 100. And they said if you probably had to pick one thing that stops more people from getting to the age of 100, it's hypertension.
Yeah, that's something we need to get that under control.
Anybody on public television, okay? So no sponsors or anything.
Wow.
That was the conclusion they came to.
So look, let's get into it then. So let's break down hypertension. What is it? What actually is it?
Yeah, I'm so glad you asked that question. I'd like to start there first. First of all, number one, you do not have to be hyper to have hypertension. That's the first thing. People say, I'm calm, I'm cool, I'm Joe Cool, whatever. Okay. But that doesn't mean you can't get hypertension. Hypertension is a sustained increase in blood pressure that can put your organs, things like your heart, your brain, your kidneys, at risk for damage. So if you have a blood pressure right now, for example, we use the number to remember 130/80 or greater. We say 130/80 or greater. If you got a blood pressure greater than that, number one, you want to know your number. Number two, if you see a blood pressure certainly greater than 130/80, particularly on a regular basis, you want to go to your doctor and talk about it. But anytime there's a sustained increase or high blood pressure reading greater than that number, that can put your target organs, again, especially your brain, your heart, and your kidneys at risk, that's what you're going to call hypertension. But it has to be sustained. Somebody who just gets a blood pressure that's only high once and they take it 99 more times, it is never high again, that's not the same as hypertension. But somebody who has hypertension that's greater than 1/3 of 80, and more importantly, if they have not been what? In the healthcare system, you need to get in the healthcare system to get repeated blood pressure readings. And if you have a sustained blood pressure reading that is high, particularly above 1/30/80 on a regular basis, that's going to be the people that need to be concerned about hypertension.
And that's why it's important. It's so important to make sure you consistently get checked and
Exactly.
get these
Keep it
updates.
consistently, often, and able to do so.
Right, right. Now, speaking of, getting that blood pressure check, what is exactly happening when you get your blood pressure? I know people go and we get the thing on our arm, it, gets all tight. Well, what's that process all about?
Sure. Let's go into that for a second. That's a great question. First of all, I try to put it in very simple terminology. The heart does two things. When it squeezes, pushes the blood out, that's your top number. That's the so-called systolic blood pressure. So when you're putting the cuff around your arm, what's happening is it squeezes down, and then, of course, it takes a certain amount of pressure before it does what? Cause turbulence or partially block the blood flow. And so there's different sounds that you listen to, for example, when you're listening with the stethoscope, to know when is it systolic or the top pressure. And then as you release the air, if you will, in the cuff down, you can get what the bottom, the diastolic blood pressure. You want to think of the top, the S standing for the squeeze, and then the D, the diastolic, standing for the D squeeze when the heart is moving towards rest. So when it's in between, if you will. So the bottom line is it's telling you what is the blood pressure. In other words, what is the pressure when the heart is actually squeezing? And what is the pressure like when the heart is in between squeezes or in between contractions, if you want to use a more scientific term. But that's what all the cuff is doing. The cuff is trying to put enough pressure on that blood vessel. It's an artery called the brachial artery. And the brachial artery is the one that the doctor will look for. Sometimes you'll see people when I walk in, I'll feel for the brachial artery on a person's arm when they put their arm out on the desk before we take the blood pressure to see if I actually feel it. And I put the cuff around it such that I know I can put enough pressure on the brachial artery so that I know when the heart is going through its squeeze phase, if you will, and when it's in between. And then you get the systolic, the top number, and the diastolic, the bottom number. But all the cuff is trying to do is trying to make it so that you can detect that squeeze when the blood pressure is higher, when the blood pressure, I should say, is forming that top number, that squeeze, and then the time that's in between. That's all the cuff is trying to do.
Got you. And those numbers now, the systolic and the diastolic numbers, yeah. What numbers are alarming? Is it the top or the bottom one? Is that one of them more alarming than the other?
That's a great question. First of all, both numbers are important.
Okay.
Now, you're going to see certain situations where obviously some numbers are more alarming than others. Now, we all know, most of us know anyway, I should say, even though we say 1/30/80 is the cutoff, we know that, for example, 200/110 is going to be a more alarming number when you see a number that high. So the bottom line is what we tell people is this. Here's one thing that's important to know. When your number is elevated above, the 1/30/80, whatever, but even if it's not super high, if you have what I call super symptoms, meaning things like if you have chest pain and somebody takes your blood pressure and says your blood pressure is a little bit high, that's not a little bit of an emergency. That's an emergency. If you have a situation where you have stroke-like symptoms, what are some of the stroke-like symptoms? Sudden changes in vision, slurred speech, inability to move one side of the body as well as you used to be able to move that side of the body, et cetera, going down through the different stroke symptoms that you have. If that is coming on, let's say if your blood pressure is only 150/90 or 160/90, whatever, people say that's not too bad. Not if I have an emergency going on, being alarming in another avenue, looking out for a stroke, i.e. signs and symptoms of a stroke, or looking out for a heart attack, especially chest pain, shortness of breath, and sweating that all may occur at one time. Even if that number is only, quote unquote, a little bit over, you're not having a little bit of emergency, you're having a full emergency.
Some stuff we definitely need to pay attention to, right?
Exactly.
And hypertension is called a silent killer, right?
Yes.
Why did it get that name?
Well, first of all, as now I like to say, getting on a little political soapbox a minute, it used to be silent because people used to say they didn't know about it.
Mm-hmm.
Now it's silent because of apathy.
Mm.
Now we have people go in and they get their blood pressure taken, and there's certainly plenty of radio spots, plenty of TV shows, plenty of awareness out there. And people sometimes choose to look the other way. That's apathy. That's different than being silent because you just don't know what's there. Now,
Right.
sure, there is no question about that. You can have high blood pressure and you may not get the symptoms. One thing we need to get clear on this program right here and now, that the days of saying, oh, I know what my blood pressure's up. No, wrong. Simple as that. I know my blood pressure's up. You may or may not know. Because when the blood pressure starts to rise, if you get to the point where you quote unquote know that the blood pressure is too high, that's probably an indication that you're at risk for some kind of damage occurring to some part of your body, i.e., your brain, i.e., your heart, i.e., your kidneys. So I hope and pray that people aren't going to wait till they know their blood pressure's up because that's probably your organ telling you, yes, we know you're getting brain damage. We know you're getting heart damage. We know you're getting kidney damage. So I certainly hope that your organs know and you know, yes, but there's going to be a time where you're going to have increased blood pressure where you're not going to get the symptoms. And when you do get symptoms, that's time to say, I bet your organs have known for a while. That's the way I like to put it that way.
They're catching up. Yeah.
Exactly.
Now, glad you brought that up because there are a lot of at-home doctors, that like
Oh,
to
yeah.
self-diagnose themselves.
Watch out for Dr. Google and all those other people.
Right. And you brought up a very good point. Now, are there any other myths that you know about with hypertension that you're like, that's
Right.
just not what it is?
Right. Well, one of the other things that we have to get straight with the men, and if people have heard me say this before, I've done a few programs around, is that people say, well, I don't want to do anything because if I take any kind of blood pressure pill, it's going to affect my nature, right? That's one of the big ones. Let's get that big one out of the way too. But I like to tell people this. Here's the words to remember for the day. Nothing will stop your stroke like a stroke. Keep that in mind. So as we go forward, we want to keep in mind that one of the big myths out there is I can't do anything about my blood pressure without having some impact on erectile function. That's myth number one. Another big myth that's out there too is that when your blood pressure goes up, like you said, you're automatically going to feel it. But the point is that sometimes some symptoms that occur that you may not attribute to the blood pressure, I should say, can indeed be related to the blood pressure. Like, for example, if somebody has really high blood pressure, one of the things that happens is what does it do? It makes your heart work harder. So sometimes you got people walking around all the time sleeping and they're tired and they don't have any energy. And they just don't attribute that to high blood pressure. They may wait for something like a headache or they may wait for something like chest pain. So one of the myths is that the only side effect you can get from high blood pressure is a headache or chest pain. That's a myth. Just being super tired and not feeling good can be the high blood pressure too. And a lot of people don't know it until I lower the blood pressure and they say, hey, I feel better. So that's a couple of the myths that are out there. But certainly if I got two things I wanted to say about the myths, those are the two myths I want people to understand. And also too, the other thing you need to keep in mind too is that another myth that's out there is that when you take a situation where you quote unquote calm down, this goes back to the word hypertension again. If I'm calm, my blood pressure must be going down, right? Because they call it hypertension. So they say, well, I was hyper a minute ago. I was upset about X, Y, and Z. I'm no longer upset. Therefore, I'm assuming my blood pressure is going down. They haven't taken it yet, but they're assuming that it's gone down because I'm cold out. Or, the other thing that people have, I had a nice little glass of wine and I watch and listen to some soft music. So therefore, my blood pressure must be coming down. It may be coming down, but it may not. So that's another method out there. But people just assume because I'm calmer, the blood pressure is going down as well.
Right. Got to be smart about all of that.
Mm-hmm.
Now, we have a great question here from Dave joining us on Facebook. He asks, are at-home blood pressure devices accurate or should you go to the doctor to have it checked? Very good question.
Oh, yeah. Let me answer this very directly. The best way to figure out how accurate it is to take the blood pressure cuff to your doctor. If there's anybody out there listening who is not taking the blood pressure cuff to their doctor, my first question would be, why not? When you want to find out if there's a funny sound in your car, do you keep driving the car around and say, sounds a little different today? I think that might be this. So I think eventually you take your car in and get it fixed and get it checked out. Blood pressure cuff is no different. You can have a dud blood pressure cuff just like you can have a dud car. Why are you going to sit down and make the assumption that it may or may not be accurate at home without going to your doctor and seeing if they can compare their blood pressure numbers to your blood pressure numbers? There are some very accurate devices out there, but just like anything else, you can go out and buy a dud luxury car for a lot of money. So don't automatically assume without going to your doctor's office that your blood pressure cuff is accurate just because you paid a lot of money for it. And that's the big thing I want to have be sure. So how do you know if it's accurate? Find out. It's a short answer to the question.
Better smart, better safe than sorry.
Exactly.
That's for sure. Now, we got all this info on hypertension, but what actually causes it? Like, what is the bottom line behind this?
Right. Well, first of all, you got to keep in mind there's two types of hypertension. One is called primary hypertension. Primary hypertension means it's the hypertension that, quote unquote, garden variety hypertension a lot of people get. That means the blood pressure. So here's what I want people to remember. The blood pressure will often go up because of a variety of mechanisms going on. So let's say, for example, if I have a kidney that doesn't have the ability to process salt correctly, for example, and let's say I hang on to a lot of fluid or hang on to a lot of salt and water, then I'm going to tend to have a higher blood pressure. If I have a situation where our body's releasing a substance, like, for example, adrenaline, there's a rare disease where your body can have the adrenal gland make too much adrenaline, which will keep your blood pressure too high. Or you can have a situation where your body can release a substance which is meant to be set up to help your body in the right situation, where people have to understand that your body is set up to respond to different situations. For example, if you have a situation where you've been shot and you're trying to get over that gunshot wound and that bleed, your body may need to do what? Push that blood pressure up to try to make sure there's good blood flow into the brain in that particular situation. But if you want to think of it as one way, as one of the things that could happen with high blood pressure, think about a thermostat in your house where no matter what you do to the thermostat, it won't put the house at the right temperature. So you go to turn the thermostat way up, but it doesn't go up to the right temperature, or you go to turn it way down and it doesn't go down to the right temperature. What's happening is there's dysregulation of what's going on, and there can be multiple mechanisms working at once, which is what a lot of people have, which is people always say, well, why, doctor, do I have to take more than one medication? I'll say because you probably have more than one mechanism going on that's making your blood pressure go up. Is it something to do with your body producing a substance that makes it go up? Is your inability to handle salt and water the problem? Is it because of the fact that your blood vessels spasm or squeeze down very tight, so-called a hyper blood vessel, I guess if you want to think of it that way? Is that the cause? Or you can have all three going on at once. And we now know that a lot of people benefit from multi-drug therapy because there are multiple things happening. So it's not always just one easily identifiable cause. Now, sometimes we get a patient where you can find, let's say there's a problem with the adrenal gland, which sits on top of the kidney and is producing a substance that brings about an increase in the blood pressure. When you do an operation on that adrenal gland, for example, and take off the nodule or the mass or whatever, that may bring a blood pressure down in a specialized situations. But that's not going to necessarily be for everybody. That's going to be in certain situations. So there's sometimes are easily identifiable causes, but then there's sometimes a multitude of causes. Sometimes the answer to the question is all of the above. Sometimes inability to handle salt, inability to have the blood vessels relax and not be spasming or squeezing down, and the so-called sympathetic nervous system that's involved in what you call your fight or flight response can be overactive to some degree. Doesn't have to be one thing, it can be all of the above.
Wow. Look, if you're just joining us, welcome to our special live stream broadcast event. It's all about building up the health of the community. Heart health is the topic tonight, hypertension. We talk about blood pressure and more, all presented by the University of Maryland Medical System. If you have a question, make sure you drop it in the chat. Big shout out to Ann, who's joining us tonight from Facebook. She has a question. Doc, she says, does high cholesterol build up plaque, cause blood pressure issue outside of medicine? what other things can help eliminate this issue?
Yes. Well, first of all, high cholesterol levels, large intakes of cholesterol can build up plaque inside the blood vessels. And what can happen is that, remember, of course, everybody knows about the big three. What are the big three out there? The blood pressure, the cholesterol, and the sugar. And what people don't understand is these things kind of, if you will, gang up on us. And even if one is there, that's bad enough. But when the three of them get together, they're like the three amigos. They work bad against you. They're three the hard way. So basically what happens is that the cholesterol will cause what? You take in too much fat, you build up plaque inside the blood vessels, and then the hypertension comes along and does what? Brings about destruction potentially to the inside of the blood vessel. Now you got fat not only going through the blood vessel, but now getting sometimes what? In the blood vessel wall. Then you got the sugar, which comes along also as well, which brings about what? The kind of, if you want to call it, a high sugar is often a high inflammatory state, which makes that plaque often unstable. And if you have unstable plaque, for example, one of the things that can happen is that piece of that plaque can break off and go down to some place where you don't want it to go within the heart and bring about what? A heart attack. But think about this, simple things to remind. I'm just trying to tell everybody, have take-home things. Fat makes fat. People say, well, how did I get my cholesterol so high? How did I get fat inside my blood vessel? Fat makes fat. If you eat a lot of fatty stuff, you have the possibility of something fatty getting into your blood vessel. It's that simple. You cannot take a deep breath and make your blood vessel get fat. That's not going to happen. It's not fat in the air. So you get fat from fat. And when you start thinking about sugar and the carbohydrates, the other thing comes about as well. But the point that I think that's trying to take home, or the take home point for that question that was just asked, is that those three things really gang up on your blood vessel, if you will, the cholesterol, the blood sugar, and the blood pressure, and bring about destruction by both A, acting as the clog, and B, also destroying the blood vessel itself. So you get the double whammy on that end.
Oh, you got to watch out for that triple threat, those three.
Exactly.
Yeah. Well, we have some more questions. I want to give a shout out to Nuana. She's joining us. Nuna, excuse me. They asked, what are some warning signs that one should look out for? I'm thinking of family members that delay going to the doctor. So I'm wondering, what are some signs to look out for?
Right. Well, first of all, let me just say the quick thing. When in doubt, please check it out. Usually your body will tell you when something is wrong. We have people come in all the time and say, I was watching the Ravens game and I had felt a little something in my arm, and my arm was getting weak, or I had a big pain in my chest, but I wanted to see if, Jackson was going to score that last touchdown. So I stayed at home. I didn't call 911. Then they wound up laying on the floor. So one of the things is your body, first of all, listen to what your body says. Now, in terms of family members, sometimes there's a number of things you can see. First of all, any break from the norm that particularly seems to be out of context and out of character should be an indication to go see a doctor. Perfect example being, if I have somebody in my family who's super active and all of a sudden they tell me, I don't feel like going back upstairs. Say, why? Because, I get tired when I go up the stairs. That's the indication you might need to do something. Somebody says, well, I like to go out and I like to watch TV, and I like to go to concerts or whatever, and I like to go down to the arena or whatever, see concert. I said, well, how come you're not going to the concert tonight? Well, every time I go to the concert, I get a bad headache. That never used to happen before, but I get a bad headache. So any indication that some kind of a change in activity, particularly when it's increasing shortness of breath that's unexplainable, somebody who seems to be having a lot of discomfort, wherever the discomfort may be, like, for example, there's a thing called claudication, or peripheral vascular disease. That's like meaning that your legs hurt when you walk past a certain distance. If that hasn't been happening before and you start noticing a family member saying, well, my legs hurt when I walk more than 2 blocks, again, another warning sign. The other thing is that that many of us know from the standpoint of blood sugar and blood pressure, many times what will happen is if your kidneys stop not working as well, you can start noticing some changes significantly in the appearance and the amount of the urine that you might make. So changes in urinary patterns is another indication that you might be having target organ damage to the kidney. But still, the rule of thumb, not to make it too complex, is when in doubt, check it out. Major change that is unexpected is an indication for intervention. Just that simple.
Yeah, go check, go check, go check.
Exactly. And
That's
if you
the
check and you
advice.
don't find anything, that's not harmful. Not
Right, right.
be deadly.
Well, we're bringing up family, and we're bringing up the body and all of this stuff. And I'm sure different people react differently with all different kind of the stages and types of hypertension. Does genetics play a role in hypertension and how it's maybe passed on or dealt with?
Yeah. Well, when it comes to genetics, what I tell people is most of the genetics that seems to come about with hypertension is mostly kind of centered around the kidney. There's certain kinds of kidney disorders that can bring about elevated blood pressure. And the genetics is the field where even though we learn a lot, we know that there's certain situations where people have pretty good evidence there's probably a genetic component going on, but we may not just have the ability to identify, say, gene XYZ at this point. So genetics can certainly be a factor. The reason why I guess I don't talk about it quite as much in my own practice because it's something people can't do anything about. In other words, once you have those genetics, the only thing you can say is, okay, I got to stay on top of this. Now, genetics will do one thing. I will say that's one thing that's important. Genetics will alert you to say that it's like when you go into a house and you see smoke. Genetic is like the smoke you see when you walk in the house. That means if one person in the family is very, very sick and it seems to be out of proportion to what would normally be expected for that person's age and sex and whatever, then that could be an indication, yes, they could have a genetic disorder. You find out what that disorder is. That allows everybody else in the family to say, I'm going to get screened early and often because I know I see smoke over in the corner. Where there's smoke, there's fire. And before I get burned, I want to check this out. And that's the way to think about genetics. That's what genetics does do for you in that situation. But there are certain situations where we know that there's genetic predispositions to hypertension, and a lot of them revolve around the kidney. And of course, we know a lot of, for example, when you see a child that has hypertension that's out of proportion to what you would expect in a young person, that can be a genetically defect or a genetic polymorphism or whatever you want to call it that may be changed that would not be the same as normal.
All right. Well, looks like we got a follow-up question from Ann. She was asking about the high cholesterol and build-up plaque earlier. She wants to know, how do you flush out the plaque? She said, I know you said don't eat fat because you get fat, but that is a good question. How do you get rid of that?
Yeah. Well, basically what happens is, remember, unfortunately, yes, we know that driving the cholesterol way down, let's say, for example, one of the things that a lot of, we call them lipidologists or lipid specialists will talk about, is they'll talk about when you get your cholesterol down as low as you can possibly make it almost. I mean, to the point where we now know that very, very, very low cholesterol levels are okay to do and still have us be able to sustain life. We used to think years ago that, if you take too much cholesterol out of the body, the cell membranes will fall apart or something like that. We now know better. We can drive the cholesterol down pretty low. That's really probably the only opportunity you get to get possibly what we call clot or cholesterol plaque regression or reduction in that. Because once you get, for example, an 80 or 90% blockage, I don't want to sit here and lie to anybody and tell you, yep, you're going to be able to have the doctor definitely be able to go in and tell you you got a 90% blockage. He's going to be able to change that 90% to a 10%. That's not something to do. So that's why the preventive aspect of it is so, so important. And we got to keep in mind, too, that at the end of the day, we know that, like I said, I talked about, the fat that makes fat. But like I said, again, once there's a certain buildup, when the cholesterol gets in the blood vessel wall, and like I said, again, when you get that big triad, when the hypertension has already done some damage to the wall, just think of it as like when you take something and you ingrain it into a table that, say, has a rough surface. Once you get a rough surface table, you take something and spill it on that table, trying to get that stuff out from in between the cracks is difficult, right? So we got to keep in mind that once that cholesterol gets ingrained in that blood vessel, you may be able to have some impact on it. But if you get past a certain point, it's very, very difficult to go back all the way to zero. You can't get from 90 to 80% to zero again just by changing your diet or just by eating a certain kind of food. It's not going to be that simple, unfortunately.
Once again, we are talking about Building up the health of the community. I'm saying, man, Dr. Johnson, our featured expert tonight, is giving us some amazing information. If you are joining us, please drop a question in the chat. It's all presented by University of Maryland Medical System. And, we talked about preventive stuff, but I do want to get into that. But I do want to talk about some more contributing factors, because I know stress is something that a lot of folks deal with, all different kinds of stress. Stress comes from so many places in life. You talk about this new administration. It's a lot of stress going on with all of that, but just in people's daily lives. So how does stress and other factors impact hypertension?
Right. Well, we know that what happens with stress is that, again, we used to think that there was a disconnect between the mind and the body, right? But now we know that when your mind is, affected by things like depression, stress, for example, that it has an impact on other parts of the body. We sometimes forget that the brain controls how we take a breath. The brain and the heart have to work together in unison in order for the heart to function. The brain and the lungs have to work in unison together for the lungs to function. But we sometimes forget about that. We think that, you can do something that affects the brain and not expect it to affect the rest of the body. That's just not possible. And we know, for example, that, this is a good topic to bring up, and I guess I'll throw this out there too. We talk about what happens when people go, for example, to war, and they get that so-called post-traumatic stress syndrome. That's the super example of stress, right? But yet when somebody can come back to the United States and have their brother or mother or somebody get shot in the street, and people say, oh, go back to work, get over it. So I find that amazing how that happens. So stress, what it does, it brings about a release of different types of substances, whether you want to call them hormones or chemicals or whatever you want to call them, that can bring about a change that occurs inside your body that's going to predispose you to that damage that can occur to the organs, to the blood vessels that lead to the organs, and of course to the brain itself. You can take somebody, when you talk about post-traumatic stress syndrome, what are you talking about? You're talking about is going into a situation, got a very stressful situation, and they came out differently from when they went in. So there's damage that's occurring there. And we now know that you can go and do certain kinds of sophisticated imaging of the brain and show that when somebody's been through a lot of stress, there can be a change inside the brain that you can take a picture of. So we need to keep that in mind too. And look at what happens. We see this happening now in sports, right? And I can only begin to fathom about what's going to happen in the future when we think about mixed martial arts, for example, where people are getting hit in the head even more so than football players and don't have a helmet. Mm-hmm. So when you think about that, that's going to be a situation where damage to the brain is going to have an impact later on. But stress, bottom line, will bring about a change in the organs, a change in the blood vessels, and it can cause a change in the brain itself that can alter the chemistry in such a way that you can have an overall damage that will occur to target organs in the body, whether it be brain, heart, kidneys, whatever. So we know that.
Right. So manage stress. You got to manage. This thing is about managing.
What it will manage you.
Right. Now that leads directly into prevention and management. And what are some effective ways to kind of lower your blood pressure naturally?
Right. There's got to have to be a joint effort, right? I tell people never go in this situation and just have one way of doing something. Sure, take the pills, but then there's other things you can do because you can eat your way past anything. Unfortunately, one thing we're seeing that's happening now, if you haven't heard about it already, is the so-called stomach or gastric bypass, right? You got people now who are eating their way. They're 10 years out from their gastric bypass. They're eating their way past their gastric bypass, which is very sad when you think about it. Somebody who went out and did a big operation, and now they're literally eating their way past the gastric bypass. I mean, that's just unfathomable,
That's got to be dangerous.
What's that?
It's got to be kind of a little dangerous too, right? I mean,
of course it's very dangerous because then in this situation you got two things that are happening. One, you got a situation where somebody went through a major procedure, and now they're literally eating their way past it. And two, the person member was already at risk before they went and had the gastric bypass operation. Now you're throwing another monkey wrench into the equation. So it just really, I just can't say enough about it. It's devastating. But getting back to what you were talking about a minute ago, in terms of, ways you have to think about managing your stress naturally. First of all, think about the things, that bring you pleasure, and think about the things you can do to interact with not just, like I said again, in terms of how you do, not just at your job, but also outside your job, things that you do that help release, or I should say, relax you in the home setting. So there's quote unquote, we know that there's certain kinds of foods, for example, that tend to be more relaxing for people. You can find what are your quote unquote relaxation foods that don't have to be real fatty. And I'm not talking about when you get under stress and go out and eat that meal you shouldn't eat. You're trying to go out and you're trying to feed that stress with that bad meal. We see a lot of people do that, right? They go out, I deserve this because I had a bad day today.
Right.
Eat
Stress
something
eating.
I shouldn't eat. So they got to, if you can stop that stress eating, that's part of the battle right there. Number two, you got to keep in mind as well, when you think about it, just think about ways where you can make your whole experience, i.e. your cooking, your eating, whatever, something that's a pleasurable experience. Play some nice music, relax, try to put yourself into a relaxing situation. And please take advantage of things around us that we know help us. For older people, I ask people all the time, how many grandkids do you have? Most people like being around their grandchildren. Do you have pets? We now know that I think the last statistic I saw is like now 70% of Americans own pets. We hear about companion animals, all kinds of things. So there's a lot of different ways you can do it. But the first step is to understand that it needs to be done. Because you got some people out here, unfortunately, and I know a lot of it is complicated because of the economic situation where you got people working 3 jobs. And you wonder, when are they taking the time for him or her? Because like I said, if you continue to put stress on something, I don't care what it is. If I take the greatest athlete in the world and try to make them run all day and all night without taking a break, they will eventually collapse. Doesn't matter if they're the greatest athlete on the face of the earth or not. And that's what we often seem to do ourselves.
Yeah. Got to balance it out. Got to balance it out, really. Now, you made a great point because you said make time, right? And I think that's a key
Right.
call to action.
Right.
We really got to make time to make these things important in our life. Diet, managing stress.
Right.
You talked about a lot of folks, working 3 jobs just don't have time to do a lot of things and focus on a lot of things.
Exactly.
But exercise is also something that's extremely
But I was
important.
going to get into that next week. Go ahead.
Well, go ahead. Let's talk about it.
Yeah. Well, first of all, when it comes to exercise, 2 things you want to do. First thing I try to tell everybody, remember, is that exercise should be exactly what it says is exercise. Like people always tell me all the time, so what kind of exercise you do? Well, I walk on my job. I'm not talking about walking on your job. I'm talking about doing something outside of your job again that's going to allow you to relax. Okay. So when I think about exercise, 2 things. One, exercise is meant to help, not hurt. So when you go out, you don't have to run until you're about ready to pass out. Getting moving and moving around is a start. And if I say, if you can't do anything else, if you got 3 jobs, just say, remember Dr. Johnson, strive for 5. Just give me 5 minutes in the morning of some activity. It can be just pretending you're jogging in place. It can pretend standing in front of the TV set, lifting your legs up and down, doing something like that. Number 2, just getting down on the floor and stretching out, stretching the muscle a little bit, allowing the muscles to be more flexible. A stretched and a flexed and an exercise muscle is a happy muscle. A muscle that it gets allowed to build what? Fat around it is not going to be a happy muscle. So exercise from the standpoint of aerobic exercise is the one that I always put at the forefront. You don't have to, everybody, I always tell people all the time, you're not like you're going out trying to try for a Raymond. You shouldn't have to be going out trying to lift 500 pounds. That actually puts a lot of stress on your heart. And if you already got hypertension, that can actually be very dangerous. I'm talking about aerobic, low-level exercise to start moving with. And if you want to have a simple formula to follow, move your feet twice as much as you move your fork. You'll be okay. So,
Great Ed says, yes, exercise should be fun and stress-free. Baby steps. Absolutely.
I like that.
Absolutely agree. Got to make sure you do something, though.
Once again, you got to keep moving.
Yeah, got to keep moving.
I tell people arthritis will catch you if you sit there and wait for them.
Very true. Very
Mhm.
true. Once again, welcome to the building of health of the community. Our topic tonight is heart health, hypertension, all presented by the University of Maryland Medical System. Of course, our esteemed guest is Dr. Johnson. And again, if you're joining us, you have a question, make sure you drop it in the chat, and we'll make sure we address it. Now, I also want to talk about some more contributing factors because stress is definitely one.
Mhm.
But in our community, um, we deal with stress a lot of ways. People
Right.
smoke, people drink.
And
Let's
eat
talk
too
about
much.
and right. Let's talk about those and how much of an impact they can have as well.
Yeah. Well, smoking, I've said to people several times, if I were Satan or Lucifer, whatever you want to call him, and I wanted to try to figure out something that would mess people up, I couldn't do much better than cigarettes.
Mm,
Cigarettes, they kill you over a course of time. It's not like something like a poison, right? A poison, you eat too much of it, you just die on the spot if it's a bad poison. Cigarettes, it makes you think, oh, this is fun, and I'm doing this, and I don't see anything happening. And when something does happen, it's like you're falling off a cliff, right?
mm,
You smoke for 20 years, and then in year 22, you get bad what heart attack or a bad case of cancer or something like that. So cigarettes are bad because they're so deceptive, right? If every time somebody smoked a cigarette they got sick within a week, people would stop smoking. But that's not the way it works. It normally takes years and years before people get the bad outcomes from the cigarettes at the time when their body is what least able to fight off the effects of the cigarette. So the cigarette will let you go from age 30 to age 40 and get closer. But when you get to the point where you start getting closer to senior citizenhood, that's when the cigarettes can catch up on you when you're smoking for a long period of time. And your body's what in a more vulnerable, weak position to fight off the cancer cells at that point, right?
mm.
Now, alcohol is another thing, when we take alcohol. Now, we all know you'll hear about the discussions about a little bit of alcohol, here or there, a glass of wine or something, with dinner can be okay. We all understand that. And that's true of anything. For example, even water. If I took you right now and put a hose down your throat and said, I'm going to pour 17 gallons of water down your throat in 15 seconds, you couldn't survive.
Mhm.
So the same thing is true for alcohol. A little bit of alcohol may be okay, but if you take in too much, it requires your liver to work too hard. It puts stress on the rest of your body. And many people, as we know, when they drink excessively, they will tend to have what? An increase in their blood pressure. And we know that beer is a double whammy, right? Because you hear about the expression. There's a reason why they have an expression called beer belly.
Mm.
Beer can give you what? Excess belly. And excess belly is not associated with long life, unfortunately. So we got to keep in mind that beer can do two things. One, the alcohol content, and two, you get the quote unquote beer belly, and you know that that's not a good thing either. And of course, beer tends to bring about what reinforces bad habits as well. People don't want to just have a beer. I got to have a beer and something what that's often what unhealthy to eat along with the beer. So you got to keep these things in mind when you think about how you do things. And again, these things work on you very insidiously over time. And unfortunately, that's how they get you. If something, like I said, was terrible within the first week, everybody would stop doing it. But because it waits to get you years later, that's when it's a problem. You see people who drink too much many years later, they will start to show signs of brain damage or start to show signs of liver damage and other organs in the body that get damaged. But again, that can be years later. But prior to that, they're having fun at the party and the life of the party, and everybody, here comes Joe. Yeah, Joe coming in now. We're happy to see Joe, and Joe's going to tell some funny jokes while he's drunk or whatever. But we know the reality is if Joe drinks too much, the heart will catch up with Joe probably 10 years later, 15 years later, whatever. So that's the bad part about these things.
So, two things that definitely affect you pretty much negatively, and they do lower your blood pressure. Your blood pressure, correct?
Which are we talking about now for lower the blood
Uh,
pressure?
Smoking and alcohol.
Yeah, smoking and alcohol, what happens is that it's a situation where they can affect your blood pressure, number one. And keep in mind, too, that especially when you start, and again, many people have seen this, when you especially have people when they drink, quote unquote, hard liquors or whatever in large quantities, you often will see a change in the blood pressure, not for the better, usually in that particular situation. And we know that, in terms of cigarettes, you hear about people, that's a little bit of a mixed bag in terms of what cigarettes do in the acute phase. But again, Cigarettes aren't going to necessarily do that dirty work in the first week or the second you smoke a cigarette. I'm not really talking about that. I'm really talking about what happens over the long haul and how that happens. And of course, the other thing that people don't realize, this is something I think that gets lost in the conversation about cigarettes. Most of the time, what do people with cigarettes do? They go and they sit with other people who smoke too. So you're getting not only your cigarette smoke, but you're getting secondhand cigarette smoke as well. So you tend to get the double whammy. Smokers who hang around smokers get double exposure. There's no reason why the smoke going through your nose can't get into your lungs, just like the smoke going through your mouth. So that's another thing that happens too. And there's even a thing now called third-hand cigarette smoke. People say, well, what is third-hand cigarette smoke?
Right.
That's like when somebody comes in the room and smokes too much and say they have children who are in the room to their grandchildren, the smoke gets everywhere. What do? The grandchildren touch their toy or whatever, which has to smoke over, and put their hand in their mouth. So there may be some effects of that too that may occur in certain situations where you got to worry about what? Third-hand smoke too. And I try to get people to think about that also as well.
Wow, now that's great info. Definitely didn't know about that one. See, now we talked about lowering blood pressure naturally and doing all the exercise and managing stress. Are there any supplements that are available?
That's the next thing I'm going to get into. Yeah. With supplements, it's very, very complicated because, unfortunately, we like to, we're in the academic world and we like to look at data, right? So when we try to look at data for supplements, many of the studies have been done, and this is the best way to say it, not necessarily with the highest amount of scientific integrity. So what happens is that a lot of times the studies are relatively small, and they may not have the best scientific method behind them. So it becomes more, I guess, anecdotal or word of mouth when you hear about a lot of things. There are some small studies that have been done with things like, for example, hibiscus tea. There was a study that was done with hibiscus tea to show that, it has potentially an impact to lower that. You hear about people talking about drinking small amounts of green tea, not too much. Of course, like anything else, too much can be bad, but drinking small amounts of green tea. And I know I saw it pop up on the screen a couple of times. We were talking about coenzyme Q10. Now, coenzyme Q10 may have a potential impact, again, on blood pressure in the heart, but what it really does, that I use it for the mostly in my practice, to be honest with you, is people sometimes will have the so-called drug or statin, certain kinds of drugs called atorvastatin, or certain kinds of drugs called rosuvastatin, the ones that, again, end in S-T-A-T-I-N, statin, or drugs that are used to lower cholesterol. Now, sometimes people get bad muscle aches and muscle soreness as a result of that. And when you're really worried that somebody just had a heart attack and you're trying to get their cholesterol way down with these great medications which help lower the cholesterol and potentially can decrease that person's risk of another heart attack. And then they can't take it because they say whenever they take it, it gives them a lot of muscle soreness. That's because the cholesterol drug can bring about some muscle soreness. And in some patients, it can be partially or sometimes fully pushed away by using the coenzyme Q10. That's when I use it the most in my practice. I'll say try some coenzyme Q10, because the reality of the situation is if you don't take something to keep your cholesterol low after you've had a heart attack, you increase your risk of another heart attack. So I'd rather people take the coenzyme Q10 and try to hang in there with the medication than to stop the cholesterol medication, particularly after they've had a heart attack, or even if they've just got a lot of evidence of high cholesterol and maybe worried about plaque that may build up in the future. But bottom line is that's what coenzyme Q10 does for most of my patients in my practice. And that's what I do when I use it.
Well, definitely a great question. Give a big shout out to Nikki Witherspoon. Thank you for joining us this evening. And of course, we're talking about hypertension, and we know that it affects everyone, but people in our community, people of color, it affects us at a higher rate. Is there reasons for that, or what's the stats behind that?
Well, first of all, I like to focus, first of all, on things we can do most about it first. Because some people say it's genetic. I say, okay, if it's genetic, that's kind of the end of the conversation. You can't say a whole much. Like I tell people, you can fix what's in your blue genes, but you can't fix mom and dad's genes. So not much you can do about that. So I like to focus on the things we can do about it. Now, we know we talked about stress earlier. So we know that when you have a community that is under more stress for whatever reason, that's contributing to the increase in the blood pressure. We know that when you have more stress and when we do more stress eating, and when we work in places where we have what I like to call healthy food deserts, right, where we don't have a lot of healthy food around, you put all those things together and we disproportionately affect different communities. Now, the reality of the situation is that you can take any ethnic group and put them in that situation and they would have a similar result. But that doesn't matter. If racism is putting you there and making you go and stay in that community, then that's what's going to happen. And I give the analogy I always make is when I think about certain neighborhoods in New York City. There's certain neighborhoods in New York City and certain zip codes where you can take any ethnic group you want and put them in there and you'll come out with gangsters, right? We know that. I mean, New York has been making gangsters since, America, before America was America, right? So it doesn't matter whether you say you're this ethnic group or that ethnic group. I'll put you in that same neighborhood and eventually you got a gangster story 10 years later. So that seems to be what happens. So the same thing is true when it comes to when we look at happens in African American communities. Your zip code is just as important, if not more important, than your genetic code. So we got to keep that in mind. That's why I like to focus a little bit more on the zip code than I do on the genetic code. That's just kind of my way of approaching it.
I like that one.
Right in a bad situation, and you can make a bad outcome. Bottom line.
Right.
It's hard to make bad. It's hard to say. Excuse me. It's hard to say bad, good. When you say bad twice, last time, you usually get a third bad. Not bad, good. It doesn't usually work out that
way. Right. We're talking about how it's affecting different people. Now, what about gender, men and women? Does it affect them differently?
Yeah. Well, first of all, let's go back to the beginning a little bit on that. Okay. One of the problems we have in our society, and we got to be realistic about this, is that women get treated differently than men. That's the bottom line. I mean, I'm sure you probably have seen some of the statistics about how many young women have been the victim of some kind of unwanted sexual advance by the time they're 21 years old. Mm-hmm. So we got to keep that in the back of our mind too. Let's not mix words here. Let's be blunt. Okay, that's one. Number two, in terms of the fact that they're different, of course, hormones, different makeup and groups versus the other, we know that women, when they become postmenopausal, when they stop having their menstrual cycles, their risk becomes more like men when they get to that point. So in other words, being postmenopausal, so to speak, has an impact. When you hit that barrier, you know that changes your risk overall. And that's why when you see insurance companies, right, when you first have women and men go in, they often will give a break to the women first with an insurance policy. But as the women get older and older, they have less and less of a break because they know that once women become postmenopausal, it can change their overall risk. That's an important point to keep in mind. So sex does have an impact on that, not just the sex itself, but also the disproportionate fact that, that's why we have whole advocacy groups now that are trying to wake the world up to the fact that we have to stop treating our women in such a way that puts them under more stress and increases their risk when it's unnecessary from that standpoint.
Mm-hmm. And we do have some women here with us tonight. And Nikki, she says she's 39 and she takes losartan, 50 milligrams daily. She says she's also dealing with stress due to depression and anxiety and says she wants to work on her blood pressure. She says a very root juice has been helping.
Mm-hmm. And what happens is these things, I tell people the only thing we have to be careful about, of course, in us in academia, have to be careful about is that people can take these things and they can certainly do well. But when somebody says, well, show me a study that shows exactly what's going to happen when I take this, we don't have that same kind of information, of course, from the Food and Drug Administration. But now, does that mean these things don't work? I'm not saying that at all. I'm simply saying that we just don't have the data, the same amount of data to put behind it as we do behind, medications. Now, I understand that some of this is, if you want to call it politicals, because we understand that there are some people who are just biased against anything, that comes out of the ground that doesn't seem like it's coming in a small white pill. So we do understand that entity exists as well. But we do know that if you do find something, the only thing I simply tell people to do is stay alert. And be in contact with your pharmacist, for example. Because I have had some people come in and tell me, oh, I'm going to stop taking my pill because I'm going to take this other pill over here. Or, oh, I'm going to start taking this pill and not consider the fact that there may be a drug-drug interaction between what you're taking and what your doctor is prescribing. So we just want to have people be informed when they do this. And when they go on and do that and we see a result, it works. But Bruce Lee, the great martial artist, had a simple, like I said, again, solution to all of that. And he said, what's your fighting style? And he said, the one that wins. So eventually, at some point, when somebody brings in an herbal supplement to me, I'm going to say, you're going to start your herbal supplement. We're going to take your blood pressure on Thursday. But at some point in time, a month later, 6 weeks later, whatever, if I come back and we're not winning, i.e. having a lower blood pressure, as Bruce Lee said, we're going to throw that technique away because whatever that technique it is, it's not good enough to win. So my style is the one that wins.
That's right. What works will work. That's what we need. Absolutely. I know we're getting low on time here, Doctor. I'm just so grateful that we were able to have this conversation. We might need a part 2. But
I have no problem with that.
Before we leave, before we get out of here, I want you to just give a last word or your last message to those who are joining us and those who will be watching in a few.
Sure. Well, I'm going to go back to some of the things to repeat myself again. People know this is kind of my mantra. For the men out there who are afraid to take the blood pressure pills, nothing will stop your stroke like a stroke. Keep that in mind. Make sure you remember that one. And for those out there, and for those out there who think that, there's a situation where there are no health disparities and things like that, you remember that you can be in a bad situation, but try to find the good things you can, even in your bad situation. And for those who are out there who feel like, well, things are going badly, well, if you're not part of the solution, you might be part of the problem. Those are things you need to keep in mind. So if you're not involved, please get involved in something. That's the take-home away for today. If you're not sure what to do, just get involved in something. So we got this gentleman here on the line, Ryan. And if you can go out and you can just say, hey, next time the radio show comes on, just ask a question and say, Ryan, what can I get involved in? What's going on, and do something. Because if you're not sure what to do, like they should say on the basketball court, go for what you know. And if you don't know, you better ask somebody. It's simple as that. So those are the take-home words for the day for me.
Absolutely. Hey, Dr. Johnson, thank you so much for joining us. Absolutely appreciate you. And thank you for everyone that's joining us tonight. Welcome once again to Building Up the Health of the Community tonight, all about heart health, hypertension, high blood pressure. And I think we learned a thing or two tonight. So thank you once again, Dr. Johnson. Appreciate you.
Thank you, Ryan.
All right. And good night. I know we probably went over a little bit, but great information, man, and well needed. And I'm going to work on part 2. All right.
All right. We'll be ready.
All right. Thanks again,
so much.
Appreciate you.
Hang in there.